Hi everyone, my name is Sana. I am a PGY1. I'm currently an intern at Beth Israel, and I'll be starting my residency in radiology at Brigham and Women's next year. I'm here as part of one of the MST webinars to talk about the sort of ongoing coronavirus dilemma and talk about how to deal with your test being delayed. So I know that this is an ongoing problem for many of you for step 1, step 2, step 3 as well for a lot of my co-interns. And so to sort of help you to talk through how to study, how to continue to retain and stay motivated during these times, I know it's really challenging. So we'll go through some of those tips and what I would recommend that you can do to sort of support yourself and continue to, achieve the best. So big picture of what we're going to cover tonight. So one of the big things that we're going to be doing is knowledge maintenance. A lot of people don't know when they're going to be able to take the test. And to be honest, neither does the NBME. So making sure that you're able to continue to maintain your knowledge. Also talking about the different resources that are available, how to schedule, some of the logistics, mistakes to avoid as always in terms of your studying plan. And then, of course, we'll have a live Q&A at the end as well. We also have this chat function, so if you have questions throughout, please feel free to throw them in there. I'll try to answer as we go, but just because I'm flying solo, I might wait till the end to answer them, but feel free to throw them in as they come to you, and we'll answer them as we go. All right, so also just a brief introduction to what we do at MST. So we're med school tutors. We've been providing one-on-one online med school tutoring for students who are studying for the MCAT, who are pre-med, through residency, residents such as myself studying for step 3 and beyond. We've been doing this for almost 14 years. I personally have been with the company for 3 years now. We have med students, residents, attendings, and it's really a wonderful resource to A, learn and prepare for these tests, but also B, to carry on to the future and to really grow your medical knowledge. So what we will sort of start with today is just get a temperature on how everyone's feeling. I know that this has been an extremely, to put it lightly, sucky time. I think what I've heard from a lot of my students, what I've heard from a lot of people is that people are anxious because they don't know when they'll be able to take the test. They're a little relieved because sometimes they feel like they have more time than they thought they would. They're scared. And all of that is normal. I think what's important right now is to realize that we have no idea when this will be over. We have a sense that things are sort of plateauing. And from my perspective as a physician in Boston, I can tell you that things seem to be leveling, but things are changing every single day. Prometric is changing every single day. So really the big thing is just to, continue to keep perspective and to try and manage your expectations. I think it's very easy to everyday check Prometric and say, like, what's the newest update? And to be honest, I think it's just really important to know that they don't know. And the NBME doesn't know, and the administrators don't know. And I think that we have to sort of force ourselves as very type A med students and residents to just sort of go with the flow on this because it's obviously uncharted territory for everybody. I think one of the other things that I've heard from many of my students and from many of my friends who are still in medical school is the concern about taking step 1 during or after 3rd year. The traditional med school curriculum, as I'm sure most of you know, is to do all of your preclinical studying. And then after that, you move into more of the clinic. After taking step 1, you move into the clinical resources and the clinical rotations. Having said that, there are med schools who have not been doing this. NYU has been having their students take step 1 after 3rd year for a number of years now. Harvard is moving towards that model as well. And a number of medical schools are moving towards that. So even though it's certainly new for all of us, and well, for some of us, except for the people at NYU and Harvard, it's new for most of us. I think that it is something that also ultimately, if anything, I think it probably hurts you. Once you start to restudy the preclinical material, restudy some of those details, they do come back pretty quickly, and the clinical learning helps your performance. Sorry, I think the ambulances are going off in the background behind me. But ultimately, the clinical knowledge is really, really valuable. Some of the things that you don't even know that you're answering before really come into play once you start to study as a third year. So I don't want you to worry about that. You will find the time to do it, and your clinical experiences will absolutely help you, and you will have time to really drive those details into your head as well. So I think one of the important things to consider is, in sort of planning what you're going to be doing for the next couple of weeks to months, is how you did during your preclinical years. If you did very well, aced every exam, were pretty solid and felt confident in your knowledge, and were feeling somewhat ready to take the exam, I think it's really easy to fall into the trap of saying, I was ready to take it, I had all this momentum. And to an extent that's true, but you have a very strong foundation that will stay strong. That doesn't go away. People who do well on step one have a good foundation for third year, have a good foundation for step two, moving forward. That foundation is not going to go away. So trust that. And really focus on clinic. Focus on going to your third year rotations. Focus on learning from your patients and learning everything that you can. And not forget about the exam, but don't stress about the exam. Spend some time, 1 to 2 hours a week, see what time you can put aside, because you'll find that rotations are very busy. Find what time you can to focus on step one, and really otherwise just continue to move forward, because you will still do well. If you had a little more challenge during preclinical years, if you found yourself struggling a little closer to the border with those foundational concepts, this extra time can be a benefit to you as well. Really use this time to bulk up on your foundational knowledge. Really focus on those basic physiology concepts that may have taken a little bit longer for you to grasp during your first, preclinical years. Spend more time, and proportionally than you otherwise would have, on focusing on pulm physiology, learning those flow loop curves, making sure you go through all of the cardiology, like the myocyte action potentials. Really spend time on the physiology and focusing on the details to make sure that you have that strong foundation and have this time to use that. Also, really use those Q banks at this point. UWorld right now, and we'll talk about this a little later as well, UWorld right now is offering all of these extensions, so you should really take advantage of that to make sure you're continuing to go through those questions, that's continuing to go through, and make sure that you continue to challenge yourself and drive home that material, because there's really no substitute for just doing more questions and really solidifying that knowledge in your head. And the other part I'll say is just a plug for this active learning. So reading, lectures, all of those things, it's very easy to become passive during this time period. And honestly, even during normal dedicated studying, it's easy to sort of sit back and just let some of the videos play and just go off of those. But it's really important to make sure you're having an active component. And so what that means is doing flashcards, testing yourself every 3, 4, 5 seconds, making sure you're going through and testing what you know and what you need to work on. Watching a video sometimes can be helpful because you need to understand those foundational concepts. But when you're watching a video, I want you to challenge yourself to pause it every minute and say, okay, what did I learn? And can I write that down? And what can I do? One of the things that I personally do, and that I've asked many of my students to do to good effect, is to take notes while you're watching these videos, because that's how you solidify that content. Otherwise, it's easy to sort of veg out and not really take it in. So do flashcards, do Anki, do practice questions, do example cases, and really make sure that you are continuing to be active in your learning instead of sort of falling into the trap of sitting back and letting it sort of happen. And so some of the just sort of retention tips that we can offer for step one, I know it's, we don't know, again, like I've said, we don't know when the test is going to be reopened for people to take in the same way. And so what I really like to tell everyone, and I told this to my students even before coronavirus became a thing, this whole exam, it's a marathon. It's not a sprint. You start the marathon when you start medical school, or for some, when, towards the end of the first year, towards the beginning of second year, that's when this begins, this preparation. And so it's not important to do 4 blocks a day for this entire time. What is important is that you spend some time every day, set aside some time to continue to work on these concepts. So make sure you're using your flashcards, using UWorld, using your Q banks, and spacing them out as you go. And this really predominantly applies because these question banks are going to test the big concepts. It's going to test you on sort of nephritic versus nephrotic diseases. It's going to test you on like restrictive versus obstructive, all of those big concepts, the big picture things. But I don't want you to worry about for the time being until you know your date. I'll go so far as to say until you know when you're actually taking the exam, I would wait on the biochem. I would wait on the histo. I would wait on the IL-6, IL-5, all of these ILs. Like, don't even worry about it until you know when you're taking the exam. If it comes up and you have some time, be like, oh, I got a question about this, I'm just going to flip through. By all means, go through and review it, but don't worry about memorizing those small details at this point, because that is the stuff that will fall out of your head. That is the stuff that I even normally tell my students to save until the last 2 weeks of dedicated, because I just don't think there's value in doing that earlier. And I will also say that biochem is just, it's certainly important, but I will say it's probably less important than some of the pathology, the physiology that really goes into the understanding of the basic concepts. One of the questions that we've just gotten is, should we, quote, waste the NBMEs now or save them for when we have an actual date on the calendar? And it's a great question, especially because what I'll say is when we have actual dates, it may be sooner than you expect. So I'll say when the NBME opens up, it might be that you're able to take your test in 2 weeks from now. And so for that reason, I would say it's probably still a good idea if you have, at this point, just based on my personal opinion of where their trajectory is headed, I would still probably spend some time doing NBME exams. So I'll get to that a little later as far as when I think you should do it, but I think that it is still valuable at this point. And so as far as logistics go, so this is sort of what I was alluding to before. So if your UWorld is expiring, if your question bank is expiring, so this is a concern I've heard from many people online and from my students as well. And this is something that a lot of people are faced with. What I'll say, and I can't speak to whether they'll continue to do this, there's no official policy online, I looked, but if you email the UWorld customer service people, what I have so far heard is that they've been very understanding about the ongoing pandemic. They've been very understanding about the fact that people aren't able to take their exams and therefore have to study for longer. And they've been offering free extensions. So again, I don't know if you have to provide some sort of proof of when your date was supposed to be, etc. I'm not sure on the details, but if that is a concern of yours, I would reach out to UWorld directly, because it seems like thus far, at least, they've been fairly understanding about the ongoing situation. As far as Prometric and actually scheduling your exam. So this is the most recent update as of, I believe it's 2 days ago now. So what they've said is they're closing all of the centers in the US and Canada. So I can't speak to, other, sites in other places. In the US and Canada, they've closed sites until May 31st. So we know that at the very least, I know there's a lot of mixed messages about people getting confirmation emails, etc. I would trust this. I would say the confirmations probably automated, all of that stuff probably automated. Stick that if you will not be taking your exam, most likely if you're in the US and Canada before May 31st. And this is subject to change, of course, but I would be surprised if it happens in the next month. So bottom line being that no one knows what's going on and it's awful. But NBME doesn't know, Prometric doesn't know, UWorld doesn't know. So what I'll say is, again, as much as it is really not great for all of us, we have to sort of be somewhat happy and somewhat fluid with this uncertain times. There have also been discussions about certain medical schools, or not certain medical schools, about medical schools being able to administer these exams. There have been petitions to the NBME to try and allow individual med schools to do this, which I personally feel would be a huge game changer. But I would be surprised if that happens in the next couple of weeks to 3 to 4 weeks. These things, obviously, as you know, in medicine, things move very slowly. So I would expect it to take a little more time, but that is something that we're staying sort of abreast of at this point. As far as clerkship, so I've talked a lot about step 1 and students studying for step 1. And then part of that is students who are current third years or going to soon be third years, what clerkships might look like for them, what step 2 studying might look like for them, and thinking about that as well. And to be honest, I have no idea what each individual school's third year and fourth year curriculum is going to look like. And most of the schools at this point, from what I've heard, they don't necessarily know what their third year and fourth year rotations will look like. I've heard about residencies that are potentially doing interviews online. So really it's unclear, but I would be surprised if it's completely the same as what it used to be. I think that, again, the uncertainty is really important, but we just have to roll with the punches on this. And I think that you still should try to prepare for clerkships at this point in the same way. So if you're starting on surgery, I would get DiVirgilio's, start reading DiVirgilio's, pretend that you're going on as if nothing has changed and that COVID doesn't exist. Because at some point, these elective surgeries, these trauma surgeries, these things will still be happening. And I think that they'll start to phase in sometime over the summer, which is when most people will start their third and fourth year rotations. And so at that point, I would say it will be really important for all of you to make sure you're, keeping up to date and staying prepared to still do well, because this is still going to be what dictates your third and fourth year and ultimately your residency application and figuring out what you want to do with your life. So really pretend that you're going to go in as normal, because at some point things will return to normal. And then what I'll also say is to be safe, because during this time, I think there are a lot of medical schools who are graduating medical students early, who are starting to work early, who are, getting out in the forefront. And it's no secret that we have already, we're tight. The system is running thin. So make sure to advocate for yourself and to continue to just be an advocate and to say, at the end of the day, I don't feel comfortable doing that. I don't feel comfortable intubating this patient when I've never intubated someone before, and make sure you're an advocate for yourself. As far as studying during clerkships, so this is something that there is always a component of preparing for the rotation and preparing for the shelf, but now there's this added component of preparing for step 1 or 2 as well. So for the rotation, what I'll say, really the best, and I know this is such a cheesy line, but the best studying for the rotation is to read everything about your patients. Know everything about them, know their allergy to peanut butter, know everything that you can possibly know. Because that's what your residents and your attendings will want from you. But beyond that, also, that's really where you learn. Learning the assessment and plan, learning, okay, this person has an AKI. What are we going to do? I decide, is it pre-renal, post-renal? Really looking through those assessment and plans, figuring out what people think about when they see those problems, and working through their thought process. Search on UpToDate. So when you go into these clinics, make sure you see, okay, this person has cellulitis. What do you treat cellulitis with? How long do you treat it for? What antibiotic should I give them? Really make sure you know all of the best practices and figure out what the actual treatment course will be for each of your patients. And then pick up as many new patients as you can. At the end of the day, the more you learn, the more people you know, the better you'll be. And so that's really the rotation specific, how to do well on the wards themselves. And then there's the whole component of studying for the shelf and studying also just for, more clinical knowledge as well. And there are a couple of resources that are specific to that. Boards and Beyond is starting to roll out step 2 videos. I believe they're planning in June. And then online med ed, of course, is another big one. Doctors in Training is another one that's not mentioned on this slide that are great resources. And then there are a lot of clerkship specific resources. So there's case files in OBGYN, there's first aid for psych, for psychiatry, there's DiVirgilio's, which I believe I mentioned earlier, for surgery. And so what that will come from is really speaking to people like me, or third and fourth years from years past who have gone to your school, to ask them what resources are the best and to use those to continue to study during this time, and trying to, carve out a little bit of time every day to start to prep for those, because this time can really be a gift in that you can use it to become really, really smart and impress everyone once you get to the wards. And then preparing for step 1 and 2, this is sort of an additional component. It does make it harder for you. Ideally, you would have all taken it by now, or you would have taken it in June, or whenever your school takes it. Ideally, it would be done before you get to clerkships. But a lot of schools do it this way, and it can be done, and it can be really advantageous to you. So set aside a little time each day just to spend on some UWorld, just to spend an hour a day, an hour a week, whatever amount of time you need to say, okay, I really don't remember anything about ALL, AML, CLL, all of those, whatever the lymphoma leukemias are, and just spend like an hour being like, okay, I need to like go back and read through these things. Because you won't see that every day on the wards, but it's still going to be tested on step one. So making sure you have a little bit of time to focus on the stuff that you haven't been seeing will be really important. And just set aside like Sunday mornings for that or something and sort of break it up like that. And so what I'll say is it's really important to sort of stay in the moment, excuse me. It's really easy to get overwhelmed. I know no one knows really what's going forward and what things are going to look like in a week to a month. So really try and focus right now on what you can do and what you can do day to day or week to week, and sort of go from there. Just really be excellent at what you're doing now and then move forward. So I think that would be sort of my biggest advice. And so we've gotten a couple of sort of big things that I wanted to touch on is that what is important is focusing on the big picture stuff. So like I said, focusing on cards, palm, renal, and this applies for step one and step two, really focusing on the big organ systems to focus your studying on that during this time, because that'll be much more long-lasting knowledge. The biochem, the other items for step two, which are somewhat similar. So for step one, I would say biochem, histology, some of the radiographs, some of those things, I would focus on doing that later. So I wouldn't worry about that for now. I would delay that. For step two, some of those things would be the biostats. There's a lot more biostats on step two, some of the ethical stuff, and then some of the details of surgical management, like optho. I don't think you need to focus on the optho or the ENT, some of those small nitpicky sort of topics. I wouldn't worry about those. I think cardiology would be a good thing to start studying for now. I think in general, sort of renal failure would be a good thing to start studying for now, but there are some organ systems, some sort of broader topics like allergy, rheumatology, some of the concepts that you can wait till later. And I think the best indicator, besides me just spouting off the top of my head, is look at UWorld. Look at how many questions are in each category and go based off of that, because UWorld is pretty representative. They have way more cards questions than they have rheumatology questions, and that's deliberate. So really use that as a resource to focus where you're going to be studying. And then, so otherwise, just to briefly go over what we do at MST, and I'll get to the Q&A in just a minute. I see we have some questions coming in as well. The big thing, So what I'll say, what we do at MST, so we are, as I mentioned, one-on-one online tutoring. We provide custom schedules, and that in this time is even more important. So what we will do for our students now is, if you want to study tutor once a week, twice a week, as we typically do, great, we can do that. But now, if you don't even know when your test is, if you want to do it once a month, twice a month, we can also do that. So really, we're flexible, we're adaptable. We create adaptive tutoring sessions that can be more didactic, more question-based, more pimping, whatever works for you. We have tutors that do all of those things. And we're really a team. So if I don't know the answer to something, there is a tutor that does. If you're interested also in talking about a future career in cardiology, I don't know anything about it, but I have many friends in the company that do and can help sort of guide you towards it. If you're interested in particular residencies, same thing. I'm not there, but I probably know someone who is. So really, it's a great resource, and hopefully we can, continue to provide webinars that are useful as well. We also give, as I mentioned here, sort of what I was alluding to, planning sessions for your study period, maintenance sessions just to make sure you're still on top of the knowledge, and as I was just sort of alluding to, residency and ERAS information as well. So one of the questions that I started to get to earlier was about NBME exams. And so what I will say is most of us at this point, I think it would be useful to do some NBME exams. So like I was alluding to before, once the actual testing centers open up, it may be that you can take your test in a week from today. You can take your test in 2 weeks from today. So I would say I would probably do 2 or 3 NBME exams during this month. And if you have a month later, great, you have more time to do like 2 or 3 more. If you only have a week, then you have time to do 1 more. And so I would probably do 2 or 3 NBME exams just to sort of gauge yourself and continue to track your progress and to see where you're weaker, to sort of cater your studying. So that would be my sort of blanket statement to that. But of course, everyone's situation is different. But generally, I would say that you should be doing NBME exams at this point. And then another question I saw is regarding surgery. So some people are asking about specific books for surgery or for step 3 studying, as well as biostats for step 3. So I'll start with the surgery questions. So one of the best resources for the surgery clerkship I found was DiVirgilio's, and that is very detailed. It's a case-based book. It goes through studies of different cases that are very, very useful for clerkship itself. A lot of people liked, I believe, the Master the Boards as well for the actual shelf itself. But what I'll say, and what many people have probably heard before, is that the surgery shelf is actually a lot of general medicine and knowing when you go to surgery and when you don't. So sticking with those books would probably be the biggest starting point. And then for step 3, there really isn't a great book or resource that people use. I think mostly it's just UWorld at this point. Of course, you can supplement with some of the online med ed stuff, some of the Boards and Beyond stuff from previous years. But at this point, it's mostly just UWorld, so I would really focus on that. Then let's see what else we have. Studying for step 2 on away rotations is a great question for the rising 4th years. And so what I'll say is that I think a lot of the residency programs are going to change their expectations. So, for example, when I was applying to my residency, I was applying in medicine and radiology. And so medicine, you don't necessarily have to take step 2 before you apply. That's not the case for all specialties. Some specialties really want it. A lot of my friends were going into more competitive specialties that were very much wanted it. And so I will say I don't think it will be as important for getting, I think there'll be more understanding. As far as studying on away rotations, I think it's really the same advice I've been giving is set aside 1 or 2 hours every week, go through some UWorld, set aside your Sunday mornings if you can. I know call schedules are crazy. Set aside your Sunday mornings, go through UWorld, continue to go through and just do questions because that's really how you best learn and how you best study. And develop that longitudinal learning. Okay, what else we go? So a lot of people are asking about what NBMEs to do, when to do them, what to sort of break things off. So I would say generally what we have seen for the most predictive NBMEs, the ones I tend to leave till the end, the UWorld NBMEs, and also the NBME 18. So those are the ones I would save till the end. Do 17, do 21, do 22, do all of those earlier in your study course. But the ones I would leave until the end would be 18 and the 2 UWorld ones, because those I find to be most predictive. If it ends up you have to take your test a week after you schedule it, I would just pick one of those, 18 or the UWorld ones, but those are the ones that are typically closest. Okay, we got another one. So what is one book that I can use for step 2 as a review book or to look things up? This is a great question. And I think that this is something that a lot of people ask because a lot of people are looking for a first aid for step 1. I know that Online Med Ed has a lot of videos that they have condensed into a spiral bound notebook. I know Pocket Guide for Medicine is something that a lot of people like. Boards and Beyond has come out with a new textbook as well. Full disclosure, I am an author on that textbook, so I don't want to plug it too much. But that is another new book that is out there. A lot of people like Doctors in Training as well. So there are a lot of options. I think the general consensus is that there is no consensus. There's no one resource at this point, but I think that it's much more clerkship specific and a bunch of different resources that are available. So unfortunately, I don't have a great one answer for you. All right, let's see. And then some people are saying, how long of a dedicated do you recommend for someone with a good, so it's a good question. I mean, ultimately, it's just going to depend on how much time you have. So right now, what I'm sort of assuming is that everyone's sort of been dedicated right now. And so typically what I recommend for my students for step one, usually 4 weeks, step three, honestly, step two, sorry, 2 to 3 weeks. And really, I would just recommend going for those. And that is usually what I would say for that. But now things are a little bit different because we all have an extended dedicated study period. So a little bit harder to say, but that's generally what I recommend. What else do we have? So one of my questions has been, any advice specifically for DO students? And so, yeah, it's actually a really great point. The COMLEX and studying for this on top of the step one exam and all of those things being delayed is particularly challenging, I think, for DO students. And so what I would really recommend is just spend whatever time you can. And it's not anything especially different. But what I would say is focus most of your time at this point on COMLEX if you haven't already taken it. And then step one, I'm not sure how the scheduling works, but I would say really just focus on getting the COMLEX as solid as you can. And then step one, worry about that after. I think that, if you can spend an hour or two your Sunday mornings, that's obviously people know when I study based on the advice that I'm giving, but allocate some amount of time to focus on just step one, but I would spend the majority of your time focusing on the COMLEX at this point. All right. Okay, this is all awesome. So great. Thank you all for joining. I think at this point, if there are any other questions, feel free to throw them in the chat. But otherwise, if you have any more specific questions to your individual situation, feel free to email us. Our email is up here, hq@medschooltutors, our phone number, our website, everything. So, feel free to hit me up, and we'll try and do our best. I know that this entire time has been extremely frustrating and challenging for me as well. But if there's anything we can do to sort of help that transition, then please let us know. Thank you so much for joining us. And with that, I will sign off. And if you have any other questions, feel free to email us. Thank you so much.